Hello, my name is Christian Brindle, and this is Medicare Scary Stories. Happy Halloween, everybody!
Hi, I'm Christian Brindle, and welcome to the Everything Medicare podcast. What's up, Everything Medicare podcast? This is Christian Brindle. Let's tone down that Halloween music. Happy Halloween, everybody. I hope you're having a great day, however you are and however you may be listening, and wherever you may be at the time. Thank you for tuning in. Thank you for listening to this rendition of the Everything Medicare podcast. And today is October 31st, and it is Halloween. And today on Halloween, I wanted to take some time and tell you some terrifying stories, some scary stories, some Medicare scary stories, horror stories of people that have been on Medicare and things have just gone completely wrong. I'm going to start with a story for a man named James, okay? James is an individual that had been told by his neighbor that he would automatically be enrolled in his Medicare when he turned 65. James is a busy person. James's neighbor was drawing off of Social Security when he turned 65 a year prior. What James doesn't realize is since he's not drawing off of Social Security, he won't automatically be enrolled into A and B. James doesn't realize this. Goes 6 months after the fact before he realizes he's not enrolled and he can't enroll for another year. Don't be like James. Make sure that you're being educated. That's when Medicare horror stories really take place. I have some other stories that I'd like to share with you on things that have happened over the years to people on Medicare that could cost you if you're not careful, okay? So I pulled up the 9 most costliest mistakes and common mistakes that people can make on Medicare and how they can be incredibly terrifying this Halloween going into next year. The first one I already mentioned, people just assuming that they're going to automatically be enrolled into A and B. They won't be unless they're drawing off of Social Security benefits. Number 2, this list says, in addition, do not assume that just because you visited the Social Security office and you completed the necessary paperwork that your enrollment is necessary complete. This is so true. In 2014, the United States of America started producing over 10,000 new 65-year-olds per day. It has been overwhelming for some departments of our government, and they do not respond quickly to changes. In some instances, folks, and I can speak from this on personal experiences, I've had people that send in their applications for A and B, whether it be online or whether they're applying for Medicare after the fact, and their enrollments get lost. They fall into a black hole never to be seen again. And if you're not checking on these things when you're first getting onto Medicare, it can be a costly mistake. The next, but not least, thing that you need to watch out for that can just cause a horror story this year on Medicare going into next is that COBRA is not considered credible coverage. If you, let's say, quit working and you're in a situation where you have a year, let's say, you have a year's worth of COBRA left, and you would rather keep this COBRA and you decide to postpone it because you've heard as long as you have coverage through your work, you can push back your Medicare Parts A and B. Well, That is not necessarily the case, my friends. It is a situation where COBRA is not classified as credible coverage. So if you do elect to postpone your A and B due to COBRA and you don't decide to take it at 65 because you have COBRA coverage, you will be penalized. The rules, folks, are very simple. If you have coverage through your current employer, a current employer, remember that, you're able to postpone your Medicare without having any penalties, and you can pick it up whenever that coverage ends or you retire or whatever comes first. However, COBRA is not through a current employer, it's through a previous employer. It is not credible coverage. This is something that people have had horror stories with for many, many years. Last but not least, folks, on this segment of the Everything Medicare podcast, this is our special Halloween edition, to where we're bringing you an episode to tell you some spooky, scary stories where people have been in dramatically bad situations because they did something wrong on their Medicare plans. I have one more example before we take a break, but then we will be back to tell more scary stories in our second segment of this week's episode. The last but not least on this segment, folks, is to understand that when you first start Medicare, the most important decision you'll be making is deciding whether you're going to take keeping your Medicare Part A and Part B and adding a supplement, or replacing Medicare Part A and B with a Medicare Advantage plan. The reason why this is so important, folks, is because if you pick wrong, if you fall for a commercial that says $0 premium plan, everything included. I actually had a client of mine call me the other day. She got a notification from probably the largest insurance agency in the country that is as slimy as they come. They are doing seniors a disservice, and they're just awful. I can't say their name, but they have health in their name. They send absolutely misleading things in the mail, have misleading commercials, and this particular advertisement, folks, said that this person could get, it almost alluded that she could get full medical coverage, full dental, full vision, full hearing at no premium. After inspecting the notice, she actually considered calling them. After inspecting the notice and after having me point something out, it says could include, but it was worded in a way that people would not understand that they had out-of-pocket, tremendous out-of-pocket at that, left behind on their hospitalization coverage, which this lady has a Medicare supplement. She needs to be on a Medicare supplement due to her health concerns. Watch out this Halloween for misleading information. I have more examples of this in our second segment after we take a quick break. Don't go anywhere. I have a message for you from Randy W. Hall, the Mr. Nice Guy Medicare Advisor. When we come back, I have the scariest stories of all. Stick with me. Happy Halloween, everybody.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brendel, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody. This is our special Halloween edition of the Everything Medicare podcast. Normally we do 3 episodes a week, but this week we're doing 4 because we absolutely had to do one due to Halloween. And I hope that you're enjoying my Halloween style business suit because I have scary stories to tell you today about people that did something wrong with their Medicare, and this is the perfect day to tell them because this is the National Day of Scaring People and Fear, okay? And these aren't things that necessarily I'm bringing up and or exaggerating. These are things that you absolutely have to be aware of. Happy Halloween. All right, folks, so let's jump into our second segment after our sponsor had their say, Randy W. Hall, the Mr. Nice Guy Medicare Advisor. Today, folks, I am telling you stories about people on Medicare that have been, well, needless to say, put in a bad situation, and we're going to tell you plenty of Medicare horror stories today. Our next example comes from, well, we'll call him Mark, okay? Mark was in a situation where he did not quite understand that every single Medicare supplement and Medigap carrier out there has the same exact plans from plan to plan. So, for example, a Plan G with one insurance company is the same as a Plan G with all of the insurance companies, folks. And the one thing that makes it different from company to company, from plan to plan, is their prices, number one, and their rate increases, number two. Mark signs up for a plan with an insurance company he's known throughout his life, pays $150 more a month than he needs to. There are perfectly other good insurance companies out there with actually lower rate increase averages available that could save him literally $150 a month on that same plan. But he does not understand that by paying more does not necessarily mean you get more in the Medicare supplement world. We're all taught throughout our lives that you get what you pay for, but not in the world of Medicare sometimes. So, what does Mark do? He keeps this plan for 15 years. The rate increases are massive on this particular insurance company, but he will not listen when it comes to the fact that he could be saving so much money with another company by shopping it around. Mark is also healthy. Mark keeps this plan, like I said, for 15 years before he meets your friend Christian. Christian finally is able to put him on another Medicare supplement company. Now, in this case, Mark did not have a Plan G, he had a Plan F, but the example happens also with Plan Gs, Fs, Ns, etc. We were able to save Mark a lot of money, and he didn't even realize it was available 15 years ago. And he said that he was told by various people that he could save $100 to $150 a month with other companies at the time he signed up, but he thought in his head that I've been taught my whole life that you get what you pay for. If you pay more, you're probably going to get more. Mark didn't realize that that doesn't apply here. Mark spent probably $10,000 additional premium over the 15-year period than he needed to. He could have saved that $10,000. Could have bought himself a new toy. This is truly a horror story, folks. Our next example, folks, is quite simple, and that is there has been a local Medicare Advantage provider. I'm not going to say their name due to the fact that I might get in trouble, but this Medicare Advantage provider has covered a various number of hospitals. One hospital in particular in the center of Salt Lake City, where I live, in Utah, is a very popular hospital. People go there. This plan has covered this hospital for many years. But this plan does not realize, the local office that's running the plan here, running the organization, they don't even realize that the plan is in the network. So for years, they're turning people away on a plan that actually does cover the hospital, but they're naively telling them that they can't go to this hospital even though they could on this particular plan. It wasn't until I came along, realized they were doing this, showed them in their own booklets, in their own systems online that they can go to this plan before they realized that they actually could allow people to go to this plan. The people on the plan, I'll have you, that realized that this hospital was in the network would go there for years. The claims would get paid, no problem. It's just the people that are running the organization that handle the sales side of the organization don't even realize that the plan is in the network. You can't trust the word of mouth from the insurance company directly, because 9 times out of 10, they don't know as much as you'd like them to know, and some companies don't know hardly anything at all. If I, a humble independent local broker, know more about your plan locally than you do, you're in trouble, and that spells doom for people on Medicare that could have saved money on this plan, but they didn't sign up for it because their local office told them, hey, we won't cover this hospital, when indeed they would have. Let's take a break, folks. We'll be back in our third and final segment with more horror stories, scary stories, things that were nightmares for people on Medicare. Don't go anywhere. I'll be right back. We are back with our third and final segment of the Everything Medicare podcast. Happy Halloween, everybody. I hope that you are enjoying your day, enjoying your holiday. And today I have some spooky stories for you. My last story of the day has to do with somebody that signed up for a Medicare Advantage plan simply by calling a 1-800 number on her television. Now, this time of the year, folks, you may have noticed that the commercials you see have been outrageous. The commercials you see are long, they're complicated, they're confusing, and they're making things sound a little bit too good to be true, folks. Especially around this season, the holiday seasons, you may realize that commercials and advertising run rampant for people on Medicare with every insurance company you've heard of, and maybe then some that you didn't hear of. What the plans don't tell you on these commercials is they run advertisements for $0 premium Medicare Advantage plans with hard networks that restrict you from going in and out of network in some particular cases, these plans being HMO plans. Now, HMO plans aren't a problem if you check your doctors ahead of time, but what these people do is they see the commercials. They see the people frocking through the flowers, laughing. Everything is right in the world on this commercial. They call a 1-800 number. They sign up for a plan without even knowing if their doctor's covered. They start the plan the first of the year. They go to this doctor for months and months and months. The doctor's office doesn't know if they take the plan. They just don't ask any questions. They don't say a word about it. They bill the insurance, only to be denied over the course of 4 or 5 months. This person gets a bill for 10 different doctor visits before it's brought to her attention that, guess what? Her doctor is not in this plan's network. If she would have worked with a local broker or someone particularly that would know the area, know her doctors, know the networks that you need to be affiliated with these different Medicare Advantage plans, this could have been avoided. It's not to scare you or deter you from going with a Medicare Advantage plan. It's to know, check everything ahead of time. Check your medications, check your doctors, check the copays that will be involved on every particular situation. If everything lines up, then you're probably in good shape. But the most people that have problems with the Medicare Advantage plans sign up just like this. They call a 1-800 number. They saw a commercial. It sounds good. They like the idea of it. It rings in their ear. And the plan is not a good fit. That's the scariest story of all. People being billed for hospital stays, surgeries, and them not being covered. I've seen $50,000 bills, $100,000 bills, sometimes more. Don't be that person, folks. Make wise choices this Halloween. Make sure you're educated about your Medicare plan. If you don't know who I am, my name is Christian Brindle. I own a Medicare agency called Christian Brindle Insurance Services, where we will work with people just like you to avoid these horror stories, and then that way next Halloween I won't be telling a story about you. Call my office at 801-255-5340, 801-255-5340 if you live in the states of Utah, Idaho, Oregon, Texas, and Florida. Again, that's Utah, Idaho, Oregon, Texas, and the Sunshine State of Florida. Those are the 5 states we're licensed to work with people in. let us avoid a horror story for you folks. Happy Halloween! And make sure you stay safe. Don't let things scare you. Be educated. Have a great day.